Thank you. Great. Before we get started, we're going to do a couple of introductions here, exactly 4 actually of our cost reporting team. And then we will get right into the content. I saw someone had raised their hand. We will not be taking questions live as we go, and there isn't a chat function. So if you want to put something in the Q&A function, which should appear at the bottom right-hand corner of your screen, and there'll be a little question mark, and then it'll say Q&A. You can click there and submit that question. Our team will be watching that. So we will continue on. And sorry, introductions. That's where we're starting. My name is Megan Lindblom, and I am the Program Integrity Supervisor for the Disability Services Division here at the Minnesota Department of Human Services. My team oversees cost reporting amongst some other large-scale projects. But I will let my team introduce themselves. And first up, I see Peter, so he can answer first.
Thanks, Megan. My name is Peter Barwaltis. I am also on the Program Integrity team as a policy analyst, and happy to be here with you guys today.
And I am Dylan Adams. I am also a part of the Program Integrity team. I will be demoing today a little bit later on. Excited to be here.
Hello, everyone. I apologize. I do not have a voice, but my name is Christina Hansa. I'm a data analyst for the Program Integrity team as well.
Thanks so much for saying hi, Christina. Christina lost her voice over the weekend, so she gets a pass. You won't hear her talk much today, but she'll be on the background helping us with your questions. So I'm going to start off today, and let's look at that agenda really quick with a couple of announcements. Going to go over briefly the why and the what of cost reporting. It's really great to level set and make sure that we kind of all have the same understanding. We'll point out a couple of places you can go to get help and answers to your questions if we don't answer them today. And then Peter and Dylan are going to take some time walking through a platform demonstration and some really great tips and tricks and just overall guidance on how to do your cost reporting. So hopefully this is helpful. So few announcements, and these are kind of in response to things we need to take care of today. We already talked about that Q&A function. And again, if you missed it, down in the right-hand corner of your screen, there should be a little button that has a question mark symbol and a Q&A. You can click on that and you can submit your questions to us. They're not going to pop up in a chat-like function until we respond to them. And we may not respond to all questions, but I will say you are in good hands today. Our team is usually pretty good about seeing that while they're presenting, and they might incorporate an answer into their own presenting. So keep an ear out. If you have not yet, we would recommend that you sign into the cost reporting platform as soon as possible, just to make sure that you don't have any access issues. Because as we get closer to that deadline of August 31st for reporting, which is a short 24 days away, more and more people are going to be coming into this system. And we're only 4 of us, or 1, 2, 3, 4 of us, sorry. Only the 4 of us are providing that help. So we can only answer so much in so much time. So if you really need that help, come and get it now. Your feedback is welcome. We're all going through our first cycle of reporting. This is year 2 for us, and we learned so much in year 1, but we can always learn more. So the more feedback you provide, the better experience that you'll have in the future, as well as other providers will have in the future. So keep it coming. We just ask that you try to keep it positive. We understand that this is hard and a new thing, and we're all working through it together. And then just one more thing, when you're emailing us questions or feedback, please give us at least 3 business days to respond. That means that if you email us on a Friday, you may not hear from us until Tuesday. And that's just because we have so many questions to answer. And we want to make sure we're doing them all justice. Sending lots of questions in rapid succession, 4 in an hour or 4 in a day, does not mean that your question is going to get answered quicker. It means that there are more cases and more emails for us to get through before we can get to responding to yours. So give us 3 days. If you haven't heard back from us in a week, please feel free to bother us again. But that's also why it's really important that we keep the questions coming now instead of on the 31st, when a lot of people are going to be doing their last and final touches there. So now I'm going to go into a little bit of the why and the what of cost reporting. So why cost reporting now? This is a new thing. We're in year 2. Why did we decide to do this now? And part of it is because the legislature asked us to. But another thing is that in 2020, DWRS moved off of the banding period or the implementation period, which means we have a full-fledged grown-up rate system today. And we want to make sure that it doesn't get stuck, right? So if we're assuming costs in 2022, we don't still want to be assuming those same costs in 2030, right? I think we're all living through inflation right now and things are changing really quickly. We know that those things can change. So we want to make sure that when we're making assumptions, that they're based on current and relevant information. 2 of the assumptions that we make within the DWRS system today are circled in red on the screen. One of them is the supervision percent, which is 11%. And what that generally assumes is that every supervisor has about 9 direct reports. And for some of you, they'll be like, oh my gosh, that's so many. And for some of you, like, no, not enough yet. And so what we need to do and determine is, does everyone actually have 13 direct reports or do they have 6? And are we assuming the right amount of time that a supervisor would be spending with individual workers? That's something that we can learn from cost reporting. So we've answered the why. Let's talk about the what of cost reporting. And in its simplest terms, cost reporting is the reporting of actual costs of providing services broken out by the established cost centers, such as wages or program administration or facility costs. And these, all of the cost centers, match out to the DWRS framework cost centers as well. The purpose of this reporting is to collect that cost data that ultimately will inform DWRS rate formulas and proposals, and also inform the legislature of the cost of providing these services. The ongoing collection of this information will inform policymakers of the cost drivers and will allow for DWRS rates to be set at a place where the services are fully funded and allow for long-term service and provider long-term survival. So what is cost reporting that it isn't? An effort to collect only your business's direct costs and change your direct rate. That is not what cost reporting is. It's an aggregate reporting for all providers. And if it feels like it's just you or maybe you and your neighbor, please know that 600 providers are reporting this year. We had just under 500 last year as well. So you're in good company, and even more will come in the subsequent years as well. Cost reporting will not automatically change your rates. Any changes to the rates would be a change to the framework that have to be made by the legislature. Cost reporting is also not an audit of your business or your home. There's an auditing component as part of cost reporting, but that is an additional step that is just being implemented now, and only some people will have an audit to go along with their cost report. But overall, this is us looking to understand the cost of providing services, not audit your business. None of us are auditors. So what will be reported? The data collection happens at the provider level. So for most people, that's going to be at the highest level of the FEIN or your tax ID number. And it collects the actual costs of providing those services by those framework or rate structured categories that correspond, sorry, it is Monday morning today, with the rate assumptions, including administrative and direct care wages, benefits, and payroll taxes. That includes payments to the license holder and family members who may be providing supports within a family residential setting. Service facilities costs, including building and maintenance costs. However, this does not include residential homes, which are funded under housing supports, formerly GRH. That is not included in a DWRS rate. There could be transportation costs, program and non-program related, program administrative or service administrative costs, as well as general administrative costs. Please note that this reporting includes only DWRS services with allowances for reporting wages and costs that span multiple programs. If you provide both DWRS services and PCA services today, we are only asking about your DWRS services. So that might lead to the question of what to use to report. The simple answer is that a company's official bookkeeping records should be used whenever possible. They can be certified, they can be uncertified. That is really a decision left up to the business itself. But overall, if you have official bookkeeping, payroll records, that is what should be used to report. If you do not keep records of costs and wages, we suggest that you use trackable documentation to prove the incurred cost or payments that you have made. Things like credit card statements, bank statements should be used. And you should also save a copy in your records with your cost reporting so that should you be audited, you have the foundations of the decisions that you made. We do suggest that if you are not currently doing any record keeping or tracking payments and costs that you have with respect to the Disability Waiver Rate System services, that you start doing so. This is not a one-time request. We are in our first cycle, but anticipate that we'll have many cycles of reporting, and you can generally expect to report once every 5 years, which means that if you're reporting in 2022, you can expect by 2027 that you'll be doing this again. So tracking those costs now will make this easier in the future. We also want to note that to understand your billed units of service and revenues, both of which are asked for in the cost report, remittance payments notifications can be used from the minutes system. They should be available to you. However, DHS cannot pull all of your minutes billing for you and aggregate it and hand it over. DHS cannot tell you how much you billed. That is something that is the responsibility of the provider in this case. We also suggest that in addition to looking at the remittance payments, if you don't separately track your billing, that you start separately tracking your billing. We've heard from lots of providers, especially as we get into crunch time, looking for their revenues and their billed units. And it can take a lot of time to go back and look through all of those remittance payments and track everything if you're billing frequently. So just a heads up there too. So this slide is called "Be No More Complex Than Necessary," which is a quote, and I am not remembering the source of it at this moment, but we hear this a lot. This is complex, this is hard, you're asking a lot of questions and we don't always have an answer to them. And the response to that is that our main value is making cost reporting as simple as it can be. One great resource that you'll see is our cost reporting manual. It has been worked on for years at this point and will continue to be worked on to make sure it's plain language and we're giving examples that help people understand. Just last month, we launched the Family Provider Guidance page, which is a step-by-step plain language explanation of what family residential providers will need to do to report, as well as visuals pointing out where they can get support and which fields they need to be entering in, because that's really our value here. But we do have to recognize that DWRS rates are complex. There are a lot of assumptions and a lot of different data that go into setting those rates. And a great example of that is what this visual is on the screen. These are the employee benefits that we ask about. Now, any one provider may not report on all of these because they may not offer all of these, but every one of these are an assumed costs within the frameworks themselves today, and they have to be asked about because that is the charge we have from the law and the legislature today. Now, we may find 5 years from now, once we've collected all of the information from providers in the first cycle, that absolutely no one offers vision insurance. We may be able to adjust our assumptions and remove vision insurance, but until we have everyone's information, we can't start making those changes today. So a little bit more about reporting, and I promise I'm almost done droning on. You'll get to see the system soon. All providers that provide at least one DWRS service are required to report once every 5 years, and that began last year in 2021. We anticipate roughly 20% of providers will report every year based on random sampling. The 2022 sample is 600 providers. And like I said, we were just shy of about 500 last year. Providers are required to report on a fiscal year or a 12-month period completed in the last 18 months. So in 2022, this cost reporting year, DHS recommends reporting on calendar year 2021, which would be January to December 2021. If you did want to report on calendar year 2020, that has passed. Your cost report would have had to have been submitted by June 30th of 2022. And last but not least, if a provider fails to complete a report by the deadline, DHS is required to suspend payments until that report is completed. This, and we'll lay it out in our reporting timeline in just a slide or two, is December 1st of 2022. The deadline for reporting is August 31st, but within the statute, there is a 90-day room for continuation of reporting. So if you don't get it on the 31st, there's not going to be a negative action. But if you don't get it in by the 30th of November, then you will have your payments stopped until your cost report is completed all the way through with all of the pertinent information and submitted in the system. And here's that reporting schedule I just referenced. So because it's a random sample every year, because you won't know until it's your year to report that year, we did put in a standardized schedule. So when you get that notification, you know what to expect. And it's a pretty long timeline. So every year, a provider, through their authorized agent, is going to be notified by March 31st. And in the last 2 years, that has gone out right on March 31st. So keep an eye out and have your authorized agent keep an eye out for that email. Then a little bit of a quiet period, but you'll get a notification and reminder on June 1st that opens up a 90-day reporting period. You can report before June 1st. It's just that the statutory requirement is that we give you a 90-day notice before the first deadline, which is August 31st, coming up in a short 24 days. And then from there, if you do not complete and submit your cost report by August 31st, starting the very next day on September 1st, you're going to get the first notification of non-compliance. Those are going to come out every 30 days until December 1st, when you'll get that 90-day non-compliance email and stop payment notification. Stop payment can be processed and removed fairly quickly within a couple of business days, but I do want to point out that needing to meet payroll deadlines or other financial obligations are not a reason to remove stop payment. The only way to remove the stop payment is to complete and submit the cost report. A question we also get is it my year to report? If it's your year, your authorized agent that is listed with licensing will have received multiple notification emails as well as user login information at this point. The last time they would have heard from us was August 1st, just last Monday in 2022. So last Monday. Make sure to check all of your spam folders as well. Sometimes we do see people have that notification go into spam folders, so double check that. If you're still unsure if it's your year to report, please reach out to the cost reporting team with the email that we'll show you later with information about your organization, the name, the FEIN, NPIs and UMPIs, as well as the authorized agent's name. That's all going to help us identify and make sure that we don't somehow miss some information and say, oh, you're not reporting, and then you keep getting more information. Please note that all communication about cost reporting goes through your authorized agent. So make sure that that information is up to date. If your authorized agent has changed since about February of this year, we recommend you reach out and check in with us just because we may be missing each other with old information. If you're unclear of who your authorized agent is, please reach out to your licensor. And for family providers, it's usually the license holder themselves. We've had a lot of questions lately about getting help or getting emails through Minutes. We do not have access to that system and cannot provide technical assistance through Minutes. We will always connect with your authorized agent. Okay, just a couple more slides here. Let's talk about where you can get help and answers to your questions. So one great resource is the DWRS cost reporting website. And I know that we have all heard that sometimes government websites are not helpful. It's very hard to track down information, but we've tried to make this as simple as possible. There are 4 tabs on this cost reporting website. One is that first tab, it's called Background. That's where you can find the annual reporting schedule we just had up a couple slides ago. We've got links to live training as well as any news and update on the News and Updates tab. This new training will be up there shortly once we get it all ready to post. There is a lot of helpful resources on the resource tab, including links to an Excel-based workbook, the manual, other documents that might help you track your time or track your costs as you go forward. And then there is a links tab where you can get linked up to other relevant DHS work, whether it be learning more about DWRS or some of the reports that we developed based on this information. Another great resource, and is linked in the resource tab, believe it or not, is the DWRS cost reporting manual. This is a detailed and comprehensive plain language manual for providers to access online, right? Sometimes things can get very technical very quickly or jargony when we start out talking about finances. And so we made sure that we worked on it to get plain language, and we continue to do so today. So if you're seeing something that's a little bit confusing, you can always reach out and provide us feedback on that. That's very helpful. So each page of the cost report, and as Dylan and Peter walk through it, they'll show you these links, has a corresponding manual web page, and that's even linked within the system. So if you're going, what is this page and what am I supposed to do? Right at the top, there is a link that you can go straight to the page that'll help you out. We have additional pages as well for authorized agent and provider user guidance, cost allocation methodologies, and submission guidance. And not to forget our family provider guide page that you can use if you're a family provider. There is no option to download, and we get that question a lot. And it really has to do with us continuing to update and make sure that everything we provide is relevant. So you'll find the links to the manual on the DWRS cost reporting website and on the homepage in the system, and the individual pages on each one of those systems pages. And last but certainly not least, if you have a question that cannot be answered by all of the materials that I have provided for you here in this cost reporting training, you can send us an email at dhs.dwrscostreporting@state.mn.us, and it's linked right there for you on the slide as well. It is very findable on our website. Please submit a question. Make sure you're giving us specifics so we can help answer it the best we can. And again, remember to give us at least 3 business days for a reply. And just that second paragraph is kind of what we talked about already, so I'll gloss over it, but we are a very small team supporting a lot of providers getting through this process. As we get closer to August 31st, and then again, as we get closer to December 1st, the number of emails we're going to be getting in a day may slow our response time down. So we just want to be very transparent. If you're reporting and it's August 31st and you need an answer in 15 minutes, that is probably not something we're going to be able to provide to you. So start early and get that cost report going. So now I'm going to hand it over to Peter Byer-Walters to do some demonstration for you.
Great. Let's make Peter the presenter.
Alan, thanks, Megan. Before I jump into the demo, I want to thank you all for a lot of great questions coming in so far for the Q&A section. This is fantastic. And a lot of the stuff I was thinking in my head, Megan already covered about the manual and the website and all the resources we have too. I know we've gotten a lot of questions recently about login issues. So I'm going to try and first part of the demo, I'm going to cover how to log in, how to access the system as both users, and how to do that too. So I appreciate your patience too. I know I haven't gotten to a few emails about help and logging back in, but I have been really good about that 2 to 3 business day response time. So I really do appreciate your patience and also sending in all the information to us about those login issues. I do ask too, and maybe Megan mentioned it, maybe not, but when you do request information about logging in from us or just a general question, please do not just only include an email in it. It's really hard for us to search via email to find your provider organization and also your contact information. So please put a signature in there, tell us who you are, tell us who your organization is when you do send in questions. It's extremely helpful for us as well. So thank you very much. And thank you for your help in doing that. I really do appreciate the people that have been doing that. And also, I know we're constantly doing improvements to the system. As Megan said, I will continue to ask if you have things that you see and you caught. And we did have a question actually earlier from that there are bugs in the system, still hopefully not anymore, but we are still catching a few things. So we do really appreciate you sending those questions and saying, hey, this is not working for me right now. And we will get around to fixing those. So I really do appreciate everyone sending in those fixes as well too. I'm gonna go in, I'm gonna share my screen right now. We'll start the demo and I'll talk about how to do the login page, as I mentioned, and then I'll go through all the way to revenues. And as I talked about, I'll go through the 2 different users that we require you to use as well. So I'm gonna share my screen. Let's go here. Hopefully everybody can see that. Works well. This page, Dylan will talk about too. It's a little different for us because we are using a test environment and not the actual reporting system. It's just a way that Minute gave us to go in and use the system ourselves, not as providers. So things may look a little different, such as this login page. You can see it's a little expanded, a little bigger, but it is, all the content there is going to be the same thing. So once I get an email, it's going to have as an authorized agent, and it's my year to report. I'm going to get a username and a password. The password is going to be a temporary one that you're going to have to change around. This is the login page. Your authorized agent email or username, sorry, not email, username is going to have an admin in front of it always. So if I get an email, I'm going to type in admin.peter.byerwaltis@state.mn.us. And then I'm going to type in the password they sent me. Let's just say that temporary password is going to ask you to change that right away and fix it when you first log in. So let's just say I already did that. I'm going to go type in my password. Wait, it's the right one. Oh, I do want to point out 2 other things real quick too. Once you get that initial email, sometimes providers take a while to log back in, and when they do, there's some things wrong with the password, or they can't, for whatever reason, it's not working. The first place you want to try is right here as a link that says forgot password. So I'm actually going to click on that real quick. So I'll just go to forget password. And then it's asking you to type in your username. So when I'm the authorized agent, I'm going to make sure I don't just type in my email. I'm going to type in admin here, and then I'll click submit, and then that will reset your password for you. If that's still not working, that is when you should send in that to the cost reporting email to us and say, hey, none of this is working right now. Can you let me know? I know a few people have had issues with that already. And we have an option to reset your password for you too, but this is the first place you want to try. I'm going to go back to the login screen. And then the other thing I want to mention too is a lot of the times people are not using the correct browser or an updated version of the browser. Sometimes the login issues are a problem of this. So just make sure that you're going down here and using one of these as you log into. Today I'm using Microsoft Edge for that. So that's another issue that we've encountered too. And people trying to use their phone or tablet sometimes don't always work or may not work in general when you're trying to log into the system as well. So the last thing is, I think this is all typed in for me. I'll just make sure, log in successful, and then that will take me to the provider dashboard page. I'll just briefly go over this real quick. There used to be a navigate button here too. We took that away for authorized agents because we saw that they were just clicking this and trying to start the report right away for that. That navigate button, I'll point out, is going to be there when you log in as the user. to start the report itself. So the second user that you'll make, and I'll show you how to make that second user in a second, is going to have that navigate bar here. All right, and then over here, two types of DWRS cost reporting user accounts. So as Megan touched on briefly, there is a authorized agent account and then a provider user account. I'm sorry if I'm being really redundant with this. It's just something that like a lot of people are missing. So I apologize if I keep going over it over and again. I just want to specify that there are two different accounts for this. And I'm, like I said, I'm logged in as the authorized agent right now. That's the one with the admin in front of your email. And then I will point out too, this right here, I revamped this page from last year. And I'll just click on it. And this goes over the different roles for you on the manual. It seems like a lot, but it is really a quick read. And I even give you screenshots for how to do the process that I'm talking about right now as well. I won't go over this. I'm just showing you that there's a page here that gives you step-by-step instructions on how to interact and use the different users. And a lot of this I'm just going to talk about through the demo. And I'll go back here. This is blah, blah, blah. This is just everything that Megan was just talking about a second ago. This is just giving you the what and why of cost reporting. And then right here, instructions, this will show you that this will take you back to the manual, the page I was just on. And then this is the Excel document. I saw that somebody has a question already that was talking about how do I use the Excel document. One was on like the vehicle page, like it only gives me a certain number. Again, the Excel document is just a tool to use, so you can fill out all your information in there first, so you're not constantly having to save and go next into the report. Especially if you're a large organization, have a lot of costs, you can just put all that information in the Excel document so that when you finally get to the report, you can just reference your Excel document and plug in all the information from there. Again, it's just a tool. So please do not try and click the Excel document and then submit it to us through the cost reporting email. That is not considered a submitted report. Now, to navigate the pages, it says right here, to start the report, click the link on the report below. So as you're getting started, your report is going to be under reports not started. And this is a button a lot of providers, I don't think, knew that the report is down here. And then you click it. As I said before, some were trying to just do it through the navigate bar. So I will click this. And that will take me to the contact information page. I think one thing I really want to point out for this contact information page, and isn't said here, but as I'm being really redundant with it, once you fill out a contact, that contact's email is going to get a login. And I actually, here, I'm going to stop sharing my screen real quick. I do want to show you one thing. And then I'm going to share my screen again. Let's see, screen one, share. And so this is what that email is going to look like when you fill out a contact information individual or somebody in the contact information. That email is going to get that email address is going to get an email like this. And of course here, your username and password, temporary password, is going to show up here. Obviously that's not here now because this is just a demo, but it will show up here. And that is going to be one that doesn't have admin in front of it. And then your temporary password is going to be here. And then you just click on this link and it will take you to the system. You log in and then you start working on the report. Give me a second here. I'm going to go back to the demo. There we go. And then, so this is the contact information page. I'll just start filling out my contact information. Staff type, I'll go down here. Cost report preparer. Working title, I'll just put in the same thing. And you can put in accountant, anything for that you want. And then email. And then I'll just, it's my old address in St. Paul. Put in our work address here. Cedar, St. Paul. I'll go to the state. Minnesota. Zip code. And then I'm ready to create new contact. Once I do this, I'm going to get a pop-up message, and I'll show you what that is. It's going to say the person you're creating an account for is already a user in the system. If you need to add a person to multiple reports, please contact DHS. When this happens, that means that this email that you put in here is already in the system. And so you just send an email to us. Either there's multiple reasons for that. One of the most common ones we're seeing right now is because somebody that was doing the report last year is trying to log back in again with the same email. So we're working on a fix for that overall, but as of now, the fix is just email us at the cost reporting team and we'll make sure that you can get back in with that email. So what I'll do here to change this, I'll just, for the demo, I'll just put a 3 in there and then create new contact. Oops, same thing. Don't want to, oh, no, there it goes. That this email, Peter Bartoltis 3, is going to get an email now to log in. Obviously that email's fake, so they're not really going to get it. But if I put it in my regular email, then that email is going to get a username to log in. And that username will just be an email in general. There's no admin in front of it. And that will be the same for all of the contacts you put in here. Once I'm done doing that, I will click Save and Next, and that will take me to the provider information page. It's very important on this page is that if you are the authorized agent, you are not going to be able to fill out any information here prior. And we point that out on the manual, we point that out on multiple places that if you're the provider user, this is where you start doing the report. So the authorized agent is officially done until they need to either create more contacts or submit the report in general. So I will log back out and I will log back in as the provider user. One thing I want to point out is I do get a lot of questions about this, so I'll just, a lot of providers will say, hey, I'm entering, but there's no, button here to click Save and Next. That is because you are the authorized agent trying to enter information. So I am going to log back out. I'll go off. And I have to go, you don't have to do this, obviously I'm doing this. I will go back into the test environment. And then as a provider user, again, this is going to be that email. This is just a login that our IT gave me to log in and test the system. All right, remember my password. There you go. Log in. I am the provider user. I am going to go down here to report in progress. Now, if you're a provider user and the report's already been started, you can also, it may be under here as not started. But I will go to the one that we are demonstrating today. That will be report in progress. I'll click this one. And that will immediately take me to the page I just left, which is the provider information page. Again, this means now that I am logged in with just the email, not the one with the admin in front of it. So here, as I just mentioned, I can now add a different MPI. So do that. Yeah, actually, let me make sure. Mess this up. So, yep, thank you. Go here. And then that will add another one there for me. And I can also go in, add and delete numbers as just mentioned. Just go ahead and backspace any that were wrong or anything like that. For the rest of this page, this will not be filled out. We kind of pre-populated it already because of the demonstration. But I do want to point out, like, so if I get to something and I see, hey, what is annual and unique recipients? Well, this is always going to be the button here at the top of the page. If you get stuck, you can click this. And that will take you to the exact page that the report is referencing. So the question was, what is annual unique recipients? I will go down here and it says provider business information. This is the information I need to provide. Down here it says, oh, okay, this is what it is. Annual unique recipients within a reporting year, which is the number of people who received any service within the reporting year. Okay, got that. I will enter the full number of people. Oops, 120. Well, there we go. Years in operation, structure, for-profit, nonprofit, government, and then the cost reporting year I'm doing. I'm not sure if this is pre-populated or not. Just make sure. Oh no, it's not, because you could be. It doesn't have to be the start of the year. It's just whatever the costs are for the past 18 months from when you're starting the report. So for a lot of providers, that's just going to be the calendar year of 2021. And then click Save Next. And that will take me to the revenues page. I'm going to just make sure I didn't miss anything. Oh, and then at the top, I did mention the navigate bar too. As a provider user, I am allowed to use the navigate bar to skip through multiple pages that I will be filling out. So I can go back to provider information, and then I can go over here to revenues as well. This, again, will give you basic instructions at the top for filling this out. And then here is a cost reporting manual too, and I'll touch base on that in a second. So revenues, this is a mandatory page. And so what you're going to be doing for this, this is anything that you bill DHS for DWRS services and programs. This is what you will be filling out here. I think Megan mentioned too, this is, you can get this information from your minutes page as well. I am going to be filling this out as a day services provider. I already have a few day service revenue type codes down here. I'm going to go here. I'll click day services, and then all the day service codes for revenues are going to be in here. I will click, let's see, adult services daily. And then since we had a lot of questions on this page from last year, we did provide these little cues down, or questions. Cues. These are not cues. These are question marks. Oh gosh, Monday morning. This will say annual service revenue means the sum total of money a provider received on their service. This is not a rate. So when you're filling this out, this is total for the entire year. So I'm going to click this, $250,000 I billed for the entire year. Annual units, what does that mean? So there's no question here for me who is not familiar with service codes and service revenues and everything. I'm going to go here and I'm going to click the reporting manual. That will take me to revenues, and I'll go down. Okay, what do I fill out for this? Annual units paid. And then this will give me instruction on what this is. And real quick note to do not convert units to a different type. So if it's 15-minute, if the service type is a 15-minute, don't convert it to hourly. Just bill for each of the 15 minutes. And then it will give you an example here about what we're asking for this page. I'll go back here, annual units, I'll type 100. And then annual recipients, that's kind of self-explanatory, but I'll just click the question mark here. Annual recipients means the number of unique individuals who served in this service within a reporting year. So how many people received this day service, adult day services in the reporting year? I will click 5, and then I will go here and click create new revenue. And then that will show up here. This is the one I just entered will populate here too. You can go back and edit this. You just click this button here and then edit any of the information, click save and close, and then that will populate here again too. You can also go over and delete it as well. This is the delete button. For larger organizations, I do want to point out you can, if you have multiple revenue codes, you can go here and click and show how many you want on each page. Those totals will show up here. So all of the previous ones I did before the demo are going to have the service revenues for each. The total amount of day service is going to be here. This is not something you can go in and edit. This is just based off of these in general. So I'll go down here. Let's say I'll just delete the one I entered. Delete. And then that total amount is updated here. Let me just make sure I'm not missing anything on this page too. Oh, yes. One other thing too is that since I selected day services, that is going to drive some of the other pages in the report as well. So let's say I was a residential provider doing this. If I only did residential services, filled that in and started going through and clicking save and next, there would be options to do certain pages as compared to day services where you will be required to fill out certain pages like what is a day service facility you have, and there are residential providers. There are places where you won't be filling out certain information, and on the page it will say, yes, I want to do this, or no, I don't want to do this. And then I will click save and next. And I'm going to toss it over to my colleague Dylan in a second. I do just want to point out one thing. I think this is, nope. Let me find that page. It's letting me. Oh, I can just go up here. This is the new guide you created for family providers. And as Megan mentioned, this kind of gives a step-by-step of what is expected to you for a smaller organization or a provider organization or family provider organization. Has screenshots for every page and does everything, so you don't have to navigate the larger manual. It's a really simplified version of the manual if you're a smaller provider. But like I said, you can go in here and click, I'll just go back to navigate to revenues, and then every page gives you instructions, more detailed instructions here in the manual. Just click the link and it will take you right to the manual page that you need to use. I'm going to stop sharing my screen and I will toss it over to my colleague Dylan, who is going to do the rest of the demo.
Great, thank you, Peter. I am going to share my screen here. All right, can you all see my Firefox browser?
Yes, we can.
All right, perfect. All right, thank you, Peter, for covering the first portion of the demo. I will be covering the remaining pages and then hand it back to Peter to talk about submissions at the end. I'm currently sharing my screen. You're looking at a copy of our test environment. I think Peter's mentioned that before. The window is a little cramped, so apologies if it looks slightly off-centered or a little bit warped. It's just a test environment. So I'm logging in now as a cost report preparer. Let's imagine that Peter had just created my login, and I had gone through the steps to change my password and all that. So I will log in now as the cost report preparer. And I'm already having an error, which is not what I wanted to have happen. Oh, shoot. 1 second here while I stop sharing and try to troubleshoot this. I was able to get in earlier, so I don't know why this is not working. One moment. I will get this logged in.
I should see if I can find some good technical problems music, like in the cartoons.
I appreciate that. Okay, so sorry about that. And now sharing my screen. Okay, sorry about that, everyone. I was able to log in. Okay, so I'm coming down here to the report that is in progress that Peter kicked off for me. It's the demo day provider. I select that report, and in here we see some of the information that Peter's already entered. I am going to now navigate to the administrative and program support wages because Peter has gone through the revenues page. Okay, so you are now looking at the administrative and program support salaries, benefits, and allocations page. This is where you would report your administrative employees and contractors. So these are not the folks that you have using, who are your direct care staff. These are your admin staff. So typically people who work behind the scenes or run the business, organize the business, or help assist kind of aspects of the business that aren't directly related to the care and treatment of people in Minnesota. Apologies. Again, this test environment scrunches up some things, especially when presenting. So this language over here, it says, do you have any administrative and program support salaries and wages to report? In case you can't see it because it's cut off. I am going to select yes here because I do. The reason why you can select yes or no is because for some of our really smaller providers, particularly our family providers, they may only have one person in the company, and that would be their direct care staff. So we leave this as an option to not report for those particularly smaller providers. In this particular example for administrative and program support salaries, I'm going to select a contractor record that I will create. I will create an employee record later and show you what benefits look like. But for this portion, I will just create a contractor. Let's say that I need to have a custodian for my business. I will come over here to the, it's Monday, I'm getting all tongue-tied. I entered a job title over here in the work job title section. I'm now coming over here to the position type where I will select housekeeping and janitorial. We try to have a number of different position types that should organize how you are thinking about these particular types of employees and workers. We have an all other category if for some reason we've missed some sort of category that that you have. So just know that that is an option. But anyway, I'm going to select housekeeping and janitorial. I'm going to now select this box over here and enter the total FTEs paid during this reporting period. If you're not familiar with the term FTE, it means full-time employee or full-time equivalent. So if you have multiple people who fall under this kind of job title, you could report them as one particular line, or you could report each and every employee individually. We allow for both options. We just leave it up to you to decide what's kind of like the most effective way of reporting, because if you're a big provider, it doesn't make sense to report each employee individually. But maybe if you're a smaller provider, it doesn't make sense. It doesn't make sense to do that, and maybe it makes sense to do it a different way. So we try to have various options. I'm going to mark my custodian as one full-time employee equivalent during this period, and I will enter their total payments, which is $25,000 for the given year. I'll now create that wage. So I select to create the wage, and now as I kind of scroll down here, I can see the record that I just created for the custodian. As you can see, I also have a previous example here. For the sake of this example, I'll show off the delete feature. This is an old record that I made. I'm going to go ahead and delete it because it's not needed. And then it hops off the screen. So here's the custodian record that I did just create, and I will now talk about allocations. I'm going to come over here to the allocations portion. Let's say you have an admin staff who does some other type of work other than administration. You could designate that, if for some reason we had our custodian doing DWRS day services, we could list their their allocations as perhaps doing 90% all other administration, but 10% of their time is DWRS day services. That's probably unrealistic, let's be real, but that option does exist for the various types of employees that you do have. For this example, though, I'm going to go back to this all other administration category. I'm going to enter 100 because they spend all their time doing that type of administration. And actually, if all of their work could be applied to DWRS services administration, I could put the allocation there. So now I'm going to scroll to the bottom. I'm going to save and close. And now this just populated with 100%. So all of this custodian's salaries and wages can be allocated to all other administration. And as I scroll down here, we can see that some of these subtotals are populating as we enter data. And then finally, I'm going to briefly touch on the methodology for allocating costs. We spend a good amount of time in our resources talking about allocations. They are kind of one of our trickiest areas. And then when we go through the direct care staff, I will go into this even more, I promise. But we do ask that you and your business try to do your best job at trying to figure out how various employees spend their time. We give some recommendations on how to do that if it's not something that you do or your accounting software does, if you use those. We recommend, for example, doing a time study. So if you have an employee, maybe you can look at them for over the course of a week or two and see how much time they spend on administrative tasks versus how much time they're doing direct care and treatment for people who receive services. And then you can extrapolate that for the rest of your report. There are various options. We recommend you just pick one, but just let us know how you kind of determine that. And like I said, I will be going over allocations throughout this presentation. So now that I've completed showing you the administrative employees, I'm going to hit Save and Next and go to the direct care staff section. So I am now on the direct care staff and supervisor wages, benefits, and allocations. And I'm going to create my direct care service employee. This is my day support staff. So actually, I'm going to come over here. I'm going to select that I'm creating an employee record. And remember that there's no question at the top of this saying, like, do you have direct care staff to report? And that's because every business out there providing DWRS services should have at least one direct care staff who actually does the service that they're providing. So that's the logic there. So I'm going to create an employee record. I select this as an employee. They will have benefits that I will report in a moment. I'm going to enter their job title as day support staff. We have the option to designate if this type of position qualifies for customized pay for working with deaf and hard of hearing people. For this example, this person does not. I will now come over and select the position type. And here we have direct care supervisor, worker, and then a licensed direct care worker. Just note here that, and we cover this in the manual as well, that a licensed direct care worker, that refers to like an RN or an LPN, not necessarily somebody who has a DWRS license or an HCBS license. This is specifically referring to mostly nursing. So, I'm going to select direct care worker for the direct care staff, and then I will scroll down where I will see multiple fields where I can enter their wages and then the hours worked. So one moment here while I start to enter some of their pay. So for my direct care staff, let's say I have one day support worker and they make $35,000 per year, and that's about 2,040 hours in a calendar year that they work. And then let's say for overtime, they get paid $3,000 for about 100 hours of overtime in a year. Next, before I enter these, you'll notice that we have vacation time, holiday time, sick time, general PTO. We realize that businesses kind of organize their benefits in different ways, and they might have a general bucket of paid time off, or they might split out their paid time off into various categories. We tried to accommodate this, however your organization does it. We're just trying to be as helpful as possible there. And if you have any questions or concerns when filling this out, feel free to add stuff in the notes section at the bottom. For this particular example, I'm going to put in $1,200 in PTO, which is the equivalent of, let's say, 80 hours. And as I scroll down here, we can add in, like I said, other types of pay, and then we have a sort of catch-all all other pay section. If you do use that section, I believe that we do ask that you clarify what type of pay or benefit that is. So now that I have filled out kind of the necessary portions around wages and hours, I'm going to scroll back down. I'm going to create that direct care wages record. And so I created it. I'm going to scroll down here. This is the daily support staff worker that I just created. You can tell because I haven't allocated their costs yet. I'm going to first go to the benefits and payroll section. And actually, let me just move that little window. So here I can enter those benefits and payroll, and let me cancel that real quick so I can just show you as a reminder. The benefits and payroll section is next to each employee line. So right here, I'll select that. I'm going to breeze through this a little bit just to kind of show you that there are some examples. This is probably not going to be the most accurate per se. So let's say that my fake organization spends about $3,000 per year in health insurance premiums for this employee, maybe another $1,000 in dental coverage. As you can see, as you go down through this list, we have all different types of benefits that you could potentially pay for. Let's say we spend about $2,000 per year in their retirement account. We have an other benefits section here in case there's something we missed. And then finally, we get to Social Security / Medicare, federal unemployment, state unemployment insurance, and workers' compensation. Those are the payroll taxes that you all complete. I will make an important note here that one of the first things that I check when I am circling back and reviewing submissions from providers is if they enter anything for Social Security, federal unemployment, state unemployment, all that jazz. That is because oftentimes providers, for whatever reason, don't put in those payroll taxes. In reality, we know that probably 90+% of providers are going to be reporting these payroll taxes. They should have those types of taxes. So if you don't report them, we know that perhaps you have things that you've missed. So I would encourage you to not forget about this section. In this particular example, let's say that we spend $4,000 in Social Security, Medicare tax, another $1,000 in unemployment, and so on. So with that, I'm going to save and close this. Again, this might not be the most realistic kind of breakdown of wages and payments, but I wanted to be able to show you kind of what these different functions are. With that, I'm now going to enter allocations for my day support staff, and the allocations is, it's right there as the next kind of button that you can press. So I'm going to go ahead and select the allocations. On this page, you can now see that we start with day services as the kind of type of allocations by default, and that's driven by by what we selected in the revenue section. So Peter mentioned that this is kind of an example day provider. So he entered revenues for day services. By entering in those revenues, that drives our allocation functioning to kind of make things easier for folks as they go through this. So if you don't have day services, you do residential, and you enter residential services into your revenue section, you'll only see residential services available as allocations throughout this to avoid confusion. Now for this example staff, they spend about 90% of their time working directly with people that they serve. I'm going to scroll down here because let's say that my employee spends about 10% of their time doing necessary paperwork and jotting down notes for the person they're serving, working on plans, all that kind of business. So they spend about 10% of their time doing DWRS service administration. I would then enter that 10% here. I'm going to save this real quick, and I will pause and kind of anticipate the inevitable question that we always get, which is, what if I have somebody who splits their time perfectly 50-50 between administration and direct care staff, or direct care? In that particular example, you could put that person in either section, the administrative section. So again, there's an administrative page and there's a direct care page. You could put them in either page. Just in general, we recommend that you, when reporting an employee or a contractor, that you put them where they spend the bulk of their time. So if they mostly do administrative tasks, put them in the admin section. If they mostly do direct care, put them in the direct care section. And if they are perfectly 50-50, then that's great. You can just pick one. So with that, I have completed the direct care section here for this particular employee. Again, we ask that you talk about your methodology for determining allocating. Again, mine is already populated with my note about a time study. And then I will go to save and next. Here we have the other benefits page. And this page requires just a little bit of explanation. And that explanation is, these are supposed to be benefits that a business would have that can't be really broken down on an employee to employee kind of basis. And so one great example that we saw last year was we had a business that had season tickets, I want to say, to the Minnesota Wild. So they had season tickets. I actually don't know how much season tickets for the Wild cost, so I'm going to assume it's like $10,000. They then allocated this, to all other administration, 100%. And then they put in here that these were MN Wild season tickets. Their employees, they cycled through, who could go to a game. Like, some people wouldn't always go to games, some people would. So these would be a benefit that you would provide to your staff, but again, it might just be a little hard to kind of delineate exactly who that benefit is given to, so you can just kind of allocate it overall to the business as a benefit, if that makes sense. Other examples that we get would be like newspaper subscriptions that the whole office could have access to, certain trainings, things like that. And because this particular box is required, I'm just going to enter time study to keep it moving. So that concludes the other benefits page. I will now hit save and next. And I hit save and next, and sometimes it just takes a moment. Okay, so we are now on the client and programming and support costs. Client programming and support costs. So this particular page is referencing the costs that are directly related to the services that your organization provides, not necessarily just kind of general business costs. There is a page for that, and I will cover that. But these are the specific costs that are related to providing those particular services. So as we scroll down here, we can see a few of those different types of costs. Oftentimes, the most that we see for them are supplies and equipment, and then also reinforcers down here. So in this example, I'm going to write $1,000 worth of supplies and equipment over this particular year. Approximately 90% of these supplies are going to day services, but we do have some use for these supplies for our other services. I will mark 10% there. And then I will scroll down to the reinforcers section. And in here, I will put in $1,000 for reinforcers. These reinforcers are all applied to the people we serve, so I'm going to put in 100% there. And again, if you scroll to the top, you can see what these columns are. And then I will scroll down. There is an other category here. Again, we try to have as many of these other kinds of categories to be as like accommodating to, you know, whatever you all are going to throw at us, because we know that we can't anticipate everything. So we try to have some catch-alls there that are available. And with that, I will say that I did a time study. In general, please put in more information than I am putting in this example. I don't have any other clients for costs, so that should be good. And then I will hit save and next. Okay, so we are now at the day, program, and facility cost section. This page will only apply to you if you have day services. So for many providers out there, you would select no. In this case, I will select yes because we are a day provider. I'm going to now enter an example address. Let's say that the site that we host our clientele is at 540 Cedar Street. You can tell that I've used this example a number of times. And in case you were wondering where 540 Cedar Street is in St. Paul, that is our office building that the Department of Human Services is based out of. St. Paul, that's 55101 in Ramsey County. We lease the space, so I will mark that. And let's say for the sake of this example, we have 1,000 square feet. So I am creating this kind of mock record for a day service facility. In here, I'm going to put in that rent for this particular example. Let's say that's $24,000 per year. You know, if this were a building that we owned, we could put in some depreciation expenses. I would say, I think, refer to our manual. I believe there's some things to know about depreciation. And then if there were any other costs associated with this particular facility, I could then mention them in these other columns here. Let's say for this example, that in the utilities section, I could just mark some utilities here. Let's say there were $1,000 in like water and sewage. That's really all that's necessary for the day facilities page. I can also put in a note here about my methodology for allocating these costs, which actually, now that I'm thinking about this note section may not be applicable to this particular example. So please ignore it as I put in a note. Oh, okay, there we go. Once it's created, there we go, get the allocation. So apologies. We spend 90% of the time doing day services at this day program facility, but we do also do some service administration here because we're doing some paperwork there as well. So I've been able to update this with my allocations, 90% in DWRS day services, 10% in admin. I can now go to save and next. That's really it for the day facilities page. We do ask in another portion of this, by the way, about other facilities you may use. I will cover that. So I will now go to transportation costs. These are transportation costs related to the services that you provide. I do have some transportation costs to report, so I select yes up at the top here. I'm going to mark down some notes about, let's say I have a vehicle that I use for my my services. I'm going to put in, for example, that I spent $4,000 in the past year on the lease for it. And then I'm going to say that I spend, or most of my transportation costs, 80% of them go to DWRS day services, and then perhaps 10% for administrative tasks related to those services, and then 10% for all other administration. That adds up to 100. And then as I scroll down, you can see there are a number of other types of costs that you can relay related to vehicles, particularly within transportation. And then as I scroll down even further, you can see we have other places where you can enter costs, for example, for mileage reimbursement for your employees or for public transportation costs if you take the people you serve and your staff with public transportation or on public transportation, I should say. You can report those costs here. And again, we have an other related cost category. It's a catch-all. So with that, I'm going to put in $500 for public transportation and then mark that this was all done as part of a program that I am doing for my clientele. I would enter in that I did a time study as part of my methodology. I don't have any other vehicle-related costs, so then I can hit save, or really I should hit save next. And so I hit save and next. The next page is vehicle costs and usage. So we do ask to track vehicles specifically. I'm going to mark yes here. And now I'm going to create a record for that vehicle that I described in the previous page, what that vehicle is and how we're kind of using it. Here I'm going to mark that I have a 2014 Chevrolet Malibu. In case you haven't seen them, that's pretty much what the bulk of the fleet of state cars are, 2014 Chevy Malibu. And let's say for this example that I acquired this vehicle on July 1st of 2014. I have not disposed of it. My vehicle does not have a lift. If there were costs of modification, I could enter those costs here. The primary county of service, because we are based in Ramsey, because we're the government, I will put Ramsey. All the way down, and there we are. For the total miles driven per year in this vehicle, I'm going to put 20,000. And then as we scroll down, we ask that you record any kind of, statistics related to the usage of the vehicle. In this example, for the vehicle I have, the average number of single passenger trips per day is 1. Average number of passengers in a shared trip, let's say 3. Percent of time with 1 passenger. Let's go down. I'm just going to go through this one a little bit more rapid fire because we're running out of time. All right, and so that is the entirety of the usage for vehicles. And I'm going to go ahead and create that vehicle. And that's all I really need to do for the vehicles page. We had a question earlier in the chat that I tried to answer. Our Excel workbook document doesn't allow for more than like 15 lines on certain pages, and one of those pages is the vehicle page. We only recommend you use the Excel workbook document as kind of like a way to organize your thoughts, to reference, to kind of start to wrap your head around how we think of costs. It's not meant to be the actual source of how you report these things. So in the actual system, you can report far more than 15 if you need to, as many as your heart desires. So I'm going to go now to the next page. So I'll select Save and Next. And this is sort of the last page where you would be reporting your costs. There is one other section that we ask you to do. I'll show that in a moment. This is general and administrative costs. So if the previous page of client programming costs and support costs, if those are things that are directly related to how you kind of provide services, general and administrative costs are kind of like everything else that could possibly be an expense that your business has. That's how we sort of think of it. So in here, we start out with like facility costs. And as you scroll down, you can see we have, everything from accounting fees, attorney fees, professional fees, licensing. You should absolutely report the licensing fees that you pay to have your business licensed. All sorts of things. I'm going to scroll back up to the top here and begin filling this out. Here, I'm going to put in a mortgage for my administrative building of $30,000. And I will say that this administrative building I have, it's 80% of the time I use it for DWRS service administration, but perhaps 20% of the time is for other administrative tasks. We get a lot of questions from family providers in particular about reporting one's mortgage for their home. Please don't do that. I believe that financial supports for your home, those exist under a different waiver or a different program. And then in addition, these are solely looking at professional settings, not a setting that could be related to one's personal home. If you would like further information about that, please read our manual or ask us questions. Just know that when we're talking about particularly administrative facilities, we're not asking for your personal home mortgage here. I'm going to keep scrolling down. I'm going to come down to the accounting and auditing fees. Let's say we spend $3,000 per year on that, and it follows a similar track: 80% for DWRS administration, another 20% for all other. And again, we try to come up with any type of cost that you could have under the sun. And there is, of course, at the bottom, an all other category if there's something we missed. Say office supplies expense, a couple hundred for that, 300. We have another section here about insurance. This is another kind of confusing one for some people. This is sort of related to not like health insurance. This might be, you know, if you have like renter's insurance or umbrella coverage for your business, any number of other types of insurances, this is where you would enter those in. And then finally, you know, taxes. These are things excluding the payroll taxes. And as I keep scrolling down, I once again emphasize that we really try to have any kind of other cost available for you to report, and multiple sections for those. So with that, I'm going to hit save and next. The final portion that I will talk about before I hand this back to Peter, there is a questionnaire at the end of the cost report. And this is getting at what kind of benefits you provide to your direct care staff. You know, the direct care worker shortage is a really big topic right now, and we're trying to collect more data on the overall industry related to direct care workers. So we ask that all providers submit this questionnaire. I'm going to go through this a little bit quickly, and I'm only going to talk about full-time folks, just for the sake of, well, an example and because we're running out of time. So I've mentioned that I have 1 full-time employee, 0 part-time. This is what the questionnaire looks like. Does your company offer holiday pay? Let's say yes. So are direct care workers eligible for that? Yes. How long do they have to wait typically for holiday pay? Let's say there's no waiting period. The minimum number of hours. Because this is holiday pay, and I'm a generous provider, I'm going to say like 0 or 1. All right. So that's holiday pay. In general, we have paid time off. I say yes, I do offer that to my employees. Direct care staff are eligible for PTO, but they have to wait a couple months. Let's say that they have to be only full-time, so over 32 hours per week that they work. I only have 1 employee, so I'm going to say 100% qualify for this. Average number of PTO days, let's say 8. So as you can see, as you scroll down through this, there are different options. Again, because of the sake of time, I'm going to not go through health insurance and other benefits. They follow the same exact kind of pattern that you see above. I will stop and talk about training real quick. You know, we do also ask, like, if training is provided to your direct care employees, you know, as like a benefit. Are they getting skills, opportunities for growth, things like that. That's also valuable information for me, or for us at DHS. So let's say 5 hours per year, and then 3 hours after that. We do provide or contribute to those costs, and we do provide tuition reimbursement to the tune of a few $1,000s. And how many receive that? 100%. So with that, I'm going to save this. I am going to actually exit out of this, sign out, and I'm going to now pass the baton, so to speak, to Peter. If I were to hit save and next, it would go to the cost report summary page, which is essentially one big giant calculator. It goes through the entire report and spits out your kind of some aggregate numbers for all the costs that you reported, all the revenues you reported as well. For this, this is our test environment, so I also think that it's not working the best. So I'm just going to hand this straight off to Peter, and thank you.
Thanks, Dylan. Awesome job. I also apologize. I think I took some of your time too. So thank you for rushing through that and getting to the end. Since we have 3 minutes left, I'm going to briefly just share my screen real quick, and we'll talk about the submission page. I know somebody had a question on that as well. One thing I do want to point out, I know that was kind of overwhelming, especially for smaller family providers. So again, I do stress that if you are a smaller provider, do go to that page I referenced about family providers finishing the report. And down here, you can see the required pages we have, possible pages, and unlikely pages. So to submit the report, once my cost report preparer is all done, filling out all the information, I think it was Julie mentioned this at the end, that they get to a point where they can no longer continue. And that is when you need to log back in as this authorized agent that has the admin plus the email. So I'll log back in as that. Oops. Sorry, let me change. I just realized I'm not in the test environment. Hold on, let me go back. I will go to test, and then I will enter that information real quick. Peter this at state admin.us over here. I will go to the report that Dylan and I were just working on. Here we go. Will first take me to contact. I'm the authorized agent, so I can't fill in any of this information in the pages here. I will go to cost report summary. This is a summary page, gives you an idea. If you're the authorized agent, I would definitely go in here and make sure all the information is correct. Summary wise, what you'll do, there is a calculate button that will calculate all the information here and populate it here. I have not done that. That's why they're all zeros showing up. In the test environment, it will also not allow me to do that. If your authorized agent also doesn't have the option to do that, I would just make sure the cost report preparer does that. I will click next here. And on this page, it gives you the instructions. There's also instructions on the manual on how to fill this out because we have 1 minute left. I'm just going to show you briefly. You click this button, and down here, you click submit. And I'm not going to do that. I just know that when you do that, you click submit here, the report is done. Once it is submitted, you cannot go back and fix it. If you have the need to do that, that is where you're going to email us at the cost reporting email to show that report is complete. I'm sorry, I briefly had to touch on that page. Any further questions about that? Again, put them in the Q&A. We'll stick around, and I will stop sharing my screen, and I'll hand it off to Megan again for final thoughts.
Thanks, Peter and Dylan, and thank you everybody for your great questions. We're trying to keep up with them in the chat. We may not get to all of them, but again, thank you for a really great training. We anticipate this training will be posted fairly soon, within probably the week. However, there is a previous training that is listed online, and one of the questions did provide the information of how to get to that training. And it is almost identical, though I think we're all wearing different outfits, to this training. So anytime you need, there is what is essentially video on demand training for you. Please go check that out if you need some help as you're completing this cost report. And yeah, with that, I think we're all done. We look forward to hearing from you and seeing your completed cost reports come in the next few weeks. So have a great day. The rest of us are going to stick around and answer some questions if you wanted to stick around and see the answers, but I think we are done recording for the day.